Hi everyone, welcome back to my channel. I'm Dr. Alpna Mahata, and today we are going to discuss two of the most promising therapies for collagen induction, microneedling and microneedling with radiofrequency, also known as MNRF. We are going to discuss which one of these two popular treatments is truly better and why. Okay, so before we pit them against each other, let's quickly define what we are talking about. Now, traditional microneedling, also known as collagen induction therapy, involves using a device with fine needles to create microscopic punctures in the skin. Think of it as a controlled form of doing micro injuries to your skin. I know it sounds scary, but these tiny channels kickstart your body's natural healing process, stimulating the production of new collagen and elastin. It's fantastic for improving skin texture, reducing scars, and tackling fine lines. Now, radio frequency microneedling takes that concept and adds a powerful twist. In MNRF, we combine mechanical action of microneedling with radio frequency energy. The needles deliver RF energy directly into the deeper layers of your skin. This added heat creates a thermal injury which further amplifies collagen and elastin production, leading to more significant skin tightening and remodeling. The idea is to get more dramatic and faster results. Now, one of the biggest concerns we hear about radio frequency, and a point that I have seen in some of my patients especially, is the risk of fat loss or atrophy. This is a very valid concern if you ask me, because radio frequency energy generates heat, and if that heat penetrates too deeply or is too intense, it can indeed damage and destroy fat cells. Now, while some practitioners intentionally use radio frequency to reduce fat in areas like a double chin on the face, unintended fat loss can lead to a gaunt appearance, sagging cheeks, and thin skin. In fact, research confirms that there is always a theoretical risk of fat loss with non-ablative radiofrequency, especially if devices are used by inexperienced hands or at excessive depths. Devices like the Morpheus8 can reach up to 4 millimeters, with heat potentially extending even further and going directly into the subcutaneous fat layer. This means precise control and expert application are absolutely crucial to prevent facial fat loss, which is essential for the youthful look of your skin. Now, traditional microneedling, on the other hand, relies purely on mechanical injury and doesn't use heat at all, and therefore it simply doesn't carry the risk of fat loss. It works within the dermis without affecting the underlying fat tissue. So, if fat preservation is the top priority for you, traditional microneedling has a clear advantage here. Now, coming to the safety of these two devices for skin of color, the heat and radio frequency can indeed trigger hyperpigmentation, especially in deeper skin tones. This is known as post-inflammatory hyperpigmentation or PIH. Now, while radiofrequency microneedling does involve heat, the consensus from recent studies and experts is that it can be safely performed even in skin of color, but with a significant caveat. It absolutely requires a knowledgeable and experienced practitioner. The key is controlled delivery of radiofrequency energy and careful management of treatment parameters. Some advanced RF devices are designed to minimize heat spread to the superficial layers, where melanocytes are more concentrated and can potentially reduce the risk of post-inflammatory hyperpigmentation. However, traditional microneedling, which causes only controlled mechanical injury without significant heat, generally carries a much lower risk of hyperpigmentation even in skin of color. The inflammatory responses triggered by mechanical injury are typically less likely to cause hyperpigmentation compared to thermal injury or thermal burns. That said, even with traditional microneedling, improper technique can lead to PIH. The takeaway here is that for skin of color, the practitioner's expertise is paramount for both procedures, but traditional microneedling inherently possesses less of a heat-related risk. As far as combination of these two therapies with other actives like exosomes and peptides, etc., is concerned, Radio frequencies heat can damage many of these actives that are usually combined with microneedling. For example, if you're going to introduce exosomes or peptides or even platelet-rich plasma and you're going to combine it with radio frequency, the heat of the radio frequency will just coagulate or damage the proteins, and none of the goodness of these topically applied formulations in the form of mesotherapy would get delivered into the skin. Traditional microneedling, on the other hand, again, it just creates microchannels that significantly enhance the absorption of topical serums and active ingredients. Crucially, because it doesn't involve heat, there is no risk of thermal degradation of mesotherapy. Finally, as far as value for money is concerned, radio frequency with microneedling is usually 2 to 3 times more expensive than traditional microneedling. Yet the core benefit, collagen stimulation, is pretty much the same. Traditional microneedling sessions typically range from $100 to up to $700, while radiofrequency microneedling can be anywhere between $800 to $2,400 per session. So, is the higher cost of radiofrequency microneedling justified? Well, it depends upon your goals. For general skin rejuvenation, improving texture, and addressing superficial concerns, traditional microneedling offers excellent value. Its lower cost makes it more accessible, and its consistent results, coupled with a lower risk profile, makes it safe and an effective choice. Radiofrequency microneedling, on the other hand, despite its higher price, offers a distinct value for those with more significant concerns like deeper wrinkles, pronounced skin laxity, or severe scarring. The added RF energy allows for deeper tissue remodeling and more dramatic tightening effects that traditional microneedling might not achieve. So, these specific, more advanced concerns, the increased investment might be more justified by the enhanced outcomes if you really want such intense results. However, this must be weighed against the increased risks and the need for a highly skilled practitioner. So, all in all, which one is better? It's not a simple answer of one being universally superior. Traditional microneedling definitely stands out for its safety profile, predictability, cost effectiveness, and for its general effect for skin improvement and its role in even combination with other skin actives. Radiofrequency microneedling, on the other hand, offers more intensive results for deeper concerns, but demands greater expertise and carries a higher risk if not performed correctly. So, guys, that's it from my side. I hope you found this episode useful. I hope you were able to make your own conclusions and decide which one of the two therapies is better for your specific skin concerns, your age, and your skin type. If you have any queries, questions, or concerns, you can connect with me through my YouTube channel on Dr. Alpna Mohta, where you can drop your comments, your queries, and I'll try to answer all of them. With that, this is Dr. Alpana signing off.